Hi everyone, we're now going to talk about the third stage of labour, or this is actually the delivery of your placenta, which is sometimes known as the afterbirth. So once your baby is being delivered and you're giving your baby a nice cuddle in skin to skin contact, your body is doing amazing things, and your uterus is actually having little contractions now in order to contract your uterus down and make it small, and we need to then deliver your placenta. So once the uterus is contracted enough and your placenta starts to separate from the line of the uterus, it's ready to be delivered. Naturally, this can take about 30 minutes, sometimes a little bit longer, and there is a slight increased amount of blood loss when it happens naturally, or we can offer you an injection, normally given at the top of your leg once your baby's born, which is a synthetic hormone of oxytocin, to bring on quite a big contraction to help separate that placenta quicker and help contract your uterus, just to help control the bleeding. And we call this an active stage of labour, so active third stage of labour, whereas if you choose for your placenta to come away naturally, it's called a physiological third stage of labour. And the midwives looking after you will ask you what you're wanting to do, so they know and they can plan for the birth. The active stage of labour normally takes about 10 minutes by the time the placenta, the uterus is contracted and placenta separated. But once the placenta is separated from your body, the midwives will have clamped the umbilical cord, and by this stage they will have also clamped baby's belly button, and usually asked birth partners if they want to cut the cord to separate baby from the placenta. And this actually also helps with the separation, the natural separation of the placenta. I'm just going to put baby down. So the midwives, they're the ones that do the work. You don't need to worry about this, and the delivery of your placenta is not like the delivery of the baby. It's just squidgy and there's no bones involved. So the midwives usually will take hold of the umbilical cord and then they pull on your placenta. I'll ask you if you want to have a look at it if you want to, but not many people do. And this is the delivery of the placenta and the membranes, which is the bag of waters that the baby is being protected inside of you for 9 months. So they then get rid of the placenta, which we do check later. But at this point then the midwives will press on your tummy, and just to make sure that uterus is nice and contracted. At this stage it's normal for ladies to bleed, so expect to bleed a little bit. We're used to that, we manage that, okay, and that's what the body's naturally doing. And once we're happy that your uterus is contracted, the midwives will then ask you if it's okay if we can check just to see if there's been any tears or any trauma inside you, and they may need to put their finger into your back passage, into your bum hole or into the vagina, just to inspect and make sure everything's okay. But at this point you're going to have baby in your arms and you won't care what